My name's Travis Alexander. I'm a postdoctoral fellow in medical humanities at Rice University, where I work on the Translational Humanities for Public Health project. We're joined today by two people who have contributed some recent research they've done together to the project, Erica Charters and Rich McKay, who co-edited a special issue of the journal Centaurus called Histories of Epidemics in the Time of COVID-19. Dr. Charters is a professor of the Global History of Medicine on the Faculty of History at Oxford University. Dr. McKay is an affiliated researcher with the Department of History and Philosophy of Science at Cambridge. And what I want to talk to him about today is how their work on the history of epidemics past might inform a little bit what we're going through with COVID now. So with that in mind, would one of you guys like to jump in and talk about what your aims were with this special issue and what you think you accomplished with it?
So I think maybe if we start to think about the timing, because I think, Rich, you can correct me if I'm wrong, but I think we started discussing this maybe April of 2020, which might seem like a long time ago, but of course was early on in the pandemic. And a lot of people were talking about things such as, wow, we've never seen anything like this before, or what can history teach us? And my sense is that being historians who've worked on epidemics and disease in the past, both of us had thoughts about whether we'd seen anything like this before, and this phrase about lessons from history.
That's absolutely right. I think it might have been even earlier than that, in March, that we were having our thoughts, having many thoughts, and it was a moment as well when many of the go-to authorities that the media might look to for explanations of what we should expect. There was very little precedent within kind of living memory that people were able to draw upon. So there was a sense of, well, bring in the historians. What do the historians of epidemics and medicines have to say about this? What can they tell us? And so there was a particular moment while everybody else was trying to, I guess, gather data and try and understand the situation a bit more, that like Eric and I and many of our colleagues kind of felt, actually, this is something. Although we will not be able to offer you a distinct, clear lesson about what you need to take away in this moment, we do have relevant expertise here. And I know that I was thinking about work that I'd done in relation to patient zero and wondering whether that there was a shared article that, I also wanted to work with a collaborator too. So I didn't realize that Erica was in the process of co-editing the special issue of Centaurus. So when I reached out to her to kind of bounce some ideas around, it felt like it was a query that landed on receptive ground.
And if I might add, because I think so Rich and I knew each other before, but we'd never actually done research or written anything together. And one of the things that was really, it was enjoyable to work with someone. And I think it's also kind of interesting to think about working with someone when we were otherwise in lockdown. And so being much more collaborative in the context of this kind of feeling of isolation. But also, my research is focused on the 18th century. And although Rich and I had various discussions about this, and I always think that history is significant, but I often have felt very hesitant about suggesting that it's directly relevant. Whereas because Rich has worked on HIV/AIDS and worked on this concept of patient zero, and I think your work, Rich, has been really fascinating in terms of working with policymakers and scientific practitioners already and being engaged in current debates about things like contact tracing. I'd always shied away from it. And so when we wrote this introduction together, it was also like this negotiation that we were having, an intellectual negotiation we were having on the page about the role of history. What do we mean when we say it's significant? And what do we mean when we say it's relevant? And how do you articulate kind of a longer term perspective in what people are seeing as being kind of an immediate, urgent crisis? So that was really enjoyable for me. Rich, you can correct me.
I'm not a correction, and I would also say I really enjoyed it. I haven't done as much collaborative writing before, and both from a sense of sharing thought space with somebody with similar but not necessarily the same kind of historical knowledge, and being able to challenge each other and I guess share the burden as well, like be able to tag team, sometimes across time zones as well. But I'm remembering as well, this wasn't the first time that we'd done work together, negotiating some of these ideas, because there had been an earlier piece for the Society for the Social History of Medicine. We were both quite involved with that. And there was a value statement where we were deliberating about what it is that historians of medicine and social historians of medicine do. And I remember, actually, this was almost kind of a prelude to some of the discussions we were having with this article, was trying to carve out a space that allowed for history to serve and be useful to audiences in the present, whilst not ignoring the important role that history had for understanding past cultures on their own terms and in with according to their own rules and values, and having to try and create a statement that allowed for both of those views. And in some ways that laid the groundwork for us to do this in a bit more detail and look at, I guess, a meta historical view of epidemics, and yeah, as Erica said, kind of going back and forth about who is this history serving, and what is its value, and what can we actually say with any certainty. So there's probably a little bit of a unresolved productive tension that exists in both of those publications.
Erica, you mentioned that that you and Rich come from very different areas of historical concern, and I wonder if you could just briefly talk about how something as a period as seemingly far removed as the 18th century can speak to the present, either through this being the origin of vaccines or some originary state control of public health. Like what's your primary lens or optic that makes the 18th century relevant to what's going on with COVID?
So I think there's a number of ways you could think about what's happening in the 18th century to help us think through what we might be going through now. One, for example, is a lot of my work has looked at the rise of the use of numbers in understanding disease, and obviously that was seen as somewhat of a novelty in the 18th century. Now we could argue that it's taken for granted, but of course the nice thing is, I think when you give something a history, then you realize that it can't be taken for granted, and it's not inevitable, and it's not the only way to understand, especially in this case, a biological or a medical phenomenon. So to me, that's a really important point to think about how the methods that we're using to observe and to collect information and then to even to publish it, what the implications are for then our social and also our medical understanding. The other part that I work on in the 18th century is, I would suggest that there's especially, so a lot of my work focuses on Europe, but also on European colonies, but there's a huge emphasis in public opinion, in the reporting and the use of newspapers. And so it always strikes me that although a lot of the rhetoric around COVID has been about how social media has this huge impact in how we're understanding this, it always strikes me as being very interesting if we can pin down what we mean by reporting, the role of public opinion. Definitely in the outbreaks of disease that I look at, disease was a political issue in the sense that it becomes something that you can use to criticize a government and to be used as a weapon in partisan politics. And that's obviously something that I think is very familiar to us today. And so again, to historicize that, I think lets us perhaps, I mean, one of the themes I would suggest, and it might have been something that Rich and I were trying to write about, is you can have something like a historical distance, right? Where you can be a little you can be a little more analytical, perhaps a little less under a kind of sense of urgency. And because the nature of an epidemic is that you feel that you're within a crisis, to me, there's a way in which once you start inserting in a historical context and a historical narrative into that space, then it gives you a chance to kind of think about it maybe more analytically, think about what your role might be and what are some of the assumptions you're having. So in that sense, it might even be less about the specifics of the 18th century and more about being able to kind of tease out similarities as well as to think about differences.
Yeah, and then I guess the parallel question for Rich would be, what is the, I know you've written pretty extensively on the so-called patient zero trope that comes into being through Randy Schultz's And the Band Played On and kind of the height of the AIDS epidemic. And I wonder how you see that trope being recycled today, and if so, what we can learn from its originary use about the not just its limited efficacy, but maybe the harm it does.
That's a great question. I mentioned at the beginning of this talk that was one of the ideas that I was wondering whether it would be part of this piece. It felt like something that I needed to write about, and that I think probably speaks to that sense of urgency that we certainly felt as historians writing this, and the publisher felt too. There was a certain kind of like trying to get this issue out as quickly as possible. So asking people all the contributors, all the peer reviewers to turn things around quickly in a kind of a crisis mode. Eventually, I ended up parceling out most of that and writing a piece for the conversation, so it's available online, where essentially I talk about the fact that the idea of patient zero was surfacing again and again, and I wanted to write something because I was getting country by country, journalists would be reaching out to me, being clearly asked by their editors to write a story about COVID patient zero, for sometimes the very first one that they were thinking about in China, but then usually for their country. And they wanted to know, why was this important to understand? And my usual response, until I ended up writing this piece, was that it's not important. I can tell you about, why it's a phrase that has taken on its importance, but if you think about it, the fact that it was coined by accident, it's really imprecise, because nobody actually knows what it means, because it's never been officially defined. You could argue that the definition in the Oxford English Dictionary is really leaves a lot to be desired, and it has a deeply stigmatizing history. All those reasons would kind of disqualify it as a helpful term, and also that leaves aside the idea that when you talk about somebody as a patient, it presupposes a certain amount of health-seeking behavior, and leaves all sorts of questions untouched with regard to asymptomatic infection. From where did that person acquire their infection? There's a whole tangle of issues that, from my perspective, and I kind of argue this throughout my work, that it would be better off left aside. I have very much come to the view that I might be fighting a losing battle on this one. It's certainly a phrase that has seen a lot of popularity, and that it does seem to be adopted in public discussions. So I don't agree, but I see it's certainly. I have written about in the past how different groups have used it because it seems like a useful phrase. And so in some ways, it continues to seem useful for the journalists, members of the public, and sometimes the scientific practitioners who are reaching for it. But I don't agree.
Yeah, I mean, this is maybe a question I would put to both of you, is maybe just why do you speculate that it continues to seem so relevant, right? Like if we posit that it is reached for recurringly, despite its shaky to non-existent empirical basis, then can you speculate on some psychological or political or even narrative drives that make it so desirable to articulate a kind of originary vector of disease? You know, where does that impulse come from? It's something I'd be curious to hear from either of you on.
Well, I still think there's more work that could be done on this, and I'd be really interested. So this is a bit speculative, but I'd be interested to speak with developmental psychologists to understand, like, at what stage of human development do we really get to grips with causation and understanding kind of cause and effect. And it seems that the patient zero phenomenon of trying to trace a complex pattern of contagion and infection to a simple explanatory kind of cause and effect. It's not just patient zero, but it's also the way that we see blame allocated and see in some really crude forms stereotypes being, you know, people being stereotyped as being associated, and in many parts of the world it was the association with China initially. So people who in some way looked as if they were Chinese were being blamed, even if, you know, there was no plausible reason at all. Like, so like blatant stereotyping and discrimination. It seems to be this, you'd argue, malformed response in terms of thinking about cause and effect. And I don't know, I'd be really curious to hear what a developmental psychologist would say. And I'd hand it over to Erica. So that's not really, I guess history is telling me that this is a common, even before patient zero existed as a term, it was a kind of a ready response to look elsewhere and to look for how to understand how diseases started. And usually blame gets inserted quite early on.
I think it's also, I mean, another way of thinking about this is disease. We still have a moral framework for thinking about disease, or we would like a moral framework that could explain disease, and especially the randomness of disease. And it strikes me that epidemics are central to this. I mean, one of the points that we wrote about in the article, and which will be very familiar to historians of medicine, is this piece by Charles Rosenberg that he wrote during the AIDS epidemic, talking about how epidemics are like a narrative and a drama. And, you know, it has a number of acts, but also this notion that it has villains and heroes. And I think part of the interesting point is epidemics are about chaos and uncertainty and fear and anxiety. And so what historians and other people who work on society would remind us of is, therefore humans try to bring some kind of order and pattern, which often involves a story about origins, a story about who's responsible and who's not responsible, and gives you back some kind of sense of control in a world that seems like you've lost control, or that you don't have sure guidance about who's going to fall ill and why they're going to fall ill. So in some ways that was something that I think actually Rich and I were keen to write about, is that this itself has a history. And of course, historians have been interested in thinking about these interpretive frameworks, because I think fundamentally one of the points if you work on epidemics as a historian is that you cannot see them just as about disease and biology. You need to see them as a human activity, and therefore to have this kind of human understanding of epidemics as this cultural and social phenomenon as well. So I would say in some ways, of course, this ties in very nicely to this notion of wanting something like a patient zero, and something that you can, is both precise and tangible, when many things seem very, very uncertain and very untangible.
All right, well then.
And just adding on to that, like one of the things that, yeah, that humans do, we tell stories really well, and we use them to relate to each other, to impose order and to make sense of things. So yeah, and it very much makes sense for historians to, well, as amongst many sorts of data that we draw upon, that stories of epidemics would form a central part.
Well, by way of wrapping up, I will encourage everyone to check out Dr. Charters and McKay's some past and future work. I know Rich's book, Patient Zero and the Making of the AIDS Epidemic, was out in 2017 and seems recurringly relevant today. And then Erica, I think you had a couple pieces that are kind of in the pipe right now that you wanted to give a quick preview of.
Yeah, well, because a few things I might flag up is Rich and I wrote this introduction, and of course it's an introduction to the rest of an issue. So there's 15 other articles available written by people who work on epidemics or parts of ways to understand epidemics, really writing from different geographic perspectives. So that's in the journal Centaurus that was co-edited also with Koen Vermeer, who's the journal editor. But I'm also running a project right now on how epidemics end. So no, I don't have the magic answer, but there's a website with videos, and there's an early publication that came out talking about how we might think about how epidemics end, or what history might help us define, but also different ways that different disciplines measure ending. And so there's going to be a special issue coming out in 2022 to coincide with the ending of the epidemic. No, just kidding, unfortunately. But yes,
heard it here first.
Yeah, but with some really, really interesting research being done, not just by historians, by a whole range of scholars. Yeah.
All right, well, that sounds great. I will say thanks again for talking with us for a bit, and I'll leave by encouraging everyone to go check out the most recent issue of Centaurus then. So we'll see you for our next interview. Thanks, guys.